Now we'll start with the treatment part. The very important part of our discussion is now what is the early treatment, like even before dialysis for kidney failure patient?
One of the very important things in kidney disease is preventing loss of protein from the kidney. So we have three medicine categories that we have as in our armamentarium to fight kidney disease. One of them is ARB or ACE inhibitors, which includes telmisartan, ramipril. These are the common ones. So they help in controlling the protein loss. Second is SGLT2 inhibitors, dapagliflozin, canagliflozin. So these are now very much part of diabetic treatment, but they also have anti-proteinuric effect. So they will prevent the protein loss in the kidney. We also have something called as finrenone, which is a newer drug which has come into our practice that also helps in controlling the protein loss. So yes, protein loss prevention is one of the main main criteria for preventing kidney failure. Already kidney loss has started, but not preventing dialysis for these patients. Another thing that we need to look into is the cause of the kidney failure. So if it is diabetic nephropathy, the control of diabetes is very important. If it is hypertensive nephropathy, very important that we control hypertension. So any of these parameters, if they're going haywire, that will affect the further deterioration of the kidney. In glomerular diseases, we have a lot of immunosuppressant medicines, which will include steroids, will include tacrolimus, will include MMF. So these are immunosuppressants, that rituximab, that help in controlling the disease. So these medicines, they help us preventing dialysis, stage 5 CKD, where we don't want the patients to go for dialysis. Unfortunately, if things don't work out, then of course we have dialysis and transplant as ways of treating people.
Yeah. So a very interesting thing to discuss here is water intake. Now we know for kidney function, initially, like we have a knowledge as like we should have a lot of water, so as our kidney function will be all right, and we usually advise a lot of water during summer. So how the treatment differs, because once the kidney fails, we ask patient to take less water. So what is the water regimen, or in early stage, or suppose high risk patient in early stage of kidney failure, and definitely in complete renal failure? So what is the regimen for the water intake?
So this is a very common question in clinical practice also, and it doesn't mean that once you have kidney dysfunction that you have to stop taking water. So that's a very false notion that anybody who has kidney disease has to stop taking water. Water restriction definitely is important for stage 5 kidney disease, because there the urine output has come down. Already the patients have symptoms of fluid overload in the terms of swelling in the legs or water in the chest, breathing difficulty. So for those patients we restrict it to 1 liter or 1.5 liters of fluid per day. Or another thing is, if the patient has some cardiac issue along with the kidney failure, in early stages also, if the heart functioning is very less, say 25%, 30%, 40%, where he may be symptomatic if I give more amount of water. So those are the patients where I restrict the fluid intake. But other patients who are producing good amount of urine, I do not restrict water. It is as per as their thirst. In fact, in certain patients who I advise SGLT2 inhibitors, I actually ask them to take more water, because SGLT2 itself acts as a diuretic. Okay. So those are the patients that we do not restrict. Stone patients, even though your kidney function may be a little haywire, creat maybe 1.6, but stone patients do require a higher amount of water intake than a normal person. So it will vary from person to person, and definitely in patients who are on dialysis or who are in stage 5 kidney patients who are still not on dialysis, in them we will restrict water.